All right.
All
Hi,
right.
guys. Good evening. This is Dr. Jenny, physical therapist. Good evening, guys. This is Dr. Jenny Yusuf, physical therapist and doctor of physical therapy, creator and founder of Balance and Pulse Support Group and Physiogen PT and Wellness. I'm your geriatric clinical specialist, certified exercise expert in aging adults, and also the Global Health in Aging Adults Vice Chair is a special interest group for the American Physical Therapy Association. So good evening, guys. If you are in United Arab of Emirates or in Saudi Arabia, salam alaikum. If you are in Philippines, magandang umaga. All right. So wherever states you are, I would like to greet you. Have a good day, guys. So for our Thanks God, it's Thursday. Another innovator, entrepreneur, physical therapist, and academicians we always interviewed for the Thanks God, it's Thursday. We are so fortunate tonight to interview another physical therapist and also well-known academician and speaker. So we have Dr. Kim Rutherford. She's the Vice President of the Education and Professional Educational Services in the American Institute of Balance. So tonight we will learn more. What is American Institute of Balance? What does they offer? What do they offer? And you remember in the Geriatric Rehab Summit, American Institute of Balance, one of our sponsor, and Dr. Richard Gans is the CEO and founder and the president of the American Institute of Balance, also discussed a wonderful topic about the vestibular, the hearing imbalance, and also falls related, right? So tonight we'll learn more about that. So welcome, Dr. Kim Rutherford. How are you?
I'm doing well. Thank you, Dr. Jenny, and thank you all for having me. This is a real pleasure.
You're welcome. So, guys, Dr. Kim is from Columbia. She was born in Columbia, Missouri, and she is now based in Florida. And she's staying now. She's the vice president of the American Institute of Balance for more than, is it like 8 years? Dr.
No, I've
Kim?
actually been with AIB going on 4 years now.
4 years, but
Don't
you're
age
in
me that
Florida.
yet. Not that fast.
Yeah, but you're in Florida for more than like I think 6 years.
Yes,
Yes.
yes. So
Yeah.
I relocated to Florida. It will be six years ago in August from Chicago. The majority
Yes.
of I'll call it my PT adult career, if you will, was originally started in Missouri, but quickly moved to Chicago, Illinois. So we moved to the Sunshine State 6 years ago.
That's beautiful. Yes, Florida. We have
Mhm.
many physical therapists there, very good clinicians in Florida.
Absolutely.
So before you become the vice president of the American Institute of Balance, you told us already that you're a physical therapist, and
Mhm.
also for them to know you already also graduated your doctorate in science in
Mhm.
physical therapy in Texas University, and also your Master of Science in Master of Physical Therapy, right? So let me
Correct.
introduce you more. So guys, this is we have Dr. Kim Rutherford. So tell us more about yourself, Dr. Kim.
Well, you've kind of given me a really nice introduction, but as you mentioned, I was born and raised in Columbia, Missouri, and I went to the University of Missouri and obtained my master's degree in physical therapy there. I'm definitely aging myself, but there was no such thing as a DPT in that area when I graduated. So I'm sure some of
Okay.
you can relate. So I did. I graduated with my MPT. I actually started my PT career in pain management and spent 2 years with that patient population, learned a lot, evolved, developed, and then moved more into sports and orthopedics, where I did my certification in manual therapy and worked in just a very busy private practice in Chicago. When I was kind of phasing out of working in Chicago and relocating to Florida, I quickly realized how much of a demand there was for the management of the dizzy patient. And whereas I thought I had a handle on managing dizzy patients and concussion patients just through trials, tribulations, working with other colleagues, and of course, taking Con Ed, I really don't think I had a full appreciation for how comprehensive their care really is. So that is what sort of led me into pursuing more vestibular and concussion rehabilitation. I went back to school, I guess, in 2006 to do my Doctorate of Science. I had a desire to get into academia as well. So I was one of those, I kind of wanted to do a little bit of everything, not just treat, but I wanted to teach and I kind of wanted to specialize more. So that took me into the Doctorate of Science route. So I've had kind of an interesting journey through my PT career. I definitely started out very heavy clinically based, specializing, working in different populations. And then I guess 20 years later, I've kind of landed in this really cool hybrid role of clinical work, research, and then academia. So very fortunate in that sense.
That's really wonderful.
Mhm.
And especially when told me, you just told us about the dizziness and also the concussion. So how, as a physical therapist, how much cases are you able to see nowadays about dizziness and concussion? And what setting are you right now that you
So
notice they have more and more cases?
yeah, that's a great question. So at the Institute, we are largely an outpatient setting. I always tell the clinicians that we train, internationally, nationally, we don't run a high volume clinic where we're treating back-to-back patients every day. Most of our patients come in for research purposes, which is really great. So we're very fortunate in the sense that volume isn't necessarily the name of our practice. But historically, when we train physical therapists, I always say, be careful what you wish for when you want to manage these patients. There are so many of them out there. We know the aging population is really booming and we're living longer. So as we live longer, as we age, patients want to age in place, and naturally comes vestibular disorders, degenerative disorders, neurological disorders. Unfortunately, falls brings head injury, trauma. So there's this large population of patients that need our help, but don't necessarily work their way through the medical system as efficiently as, say, someone with a broken arm or someone who needs surgery or even back pain. So I always tell people, if you want to treat these patients, there are lots of them out there to be treated. It's just a amount of getting in front of the right referral sources and really getting in front of your community as saying, hey, as a physical therapist or occupational therapist or rehabilitation specialist, this really is in my wheelhouse. And these patients are non-surgical, they're non-pharmaceutical. So what better patient for us to manage, quite frankly? So could you have a schedule full of dizzy patients depending on your area and where you live? Absolutely. We certainly could here in Florida with the aging population.
Wow.
For sure.
Yeah, it's an aging population. That's the state, especially for retirees. So that's really a wonderful thing.
Yes.
Especially, we're so glad that you're able to make it tonight for the balance and pulse support group. These are very important topics because you have concussion,
Mm-hmm.
vertigo, dizziness. So for our listeners, we have also clients and caregivers. How
Sure.
can you explain to them, Dr. Kim, that this is mainly dizziness versus migraine and versus vertigo? And also, when do you think that it's time for them to check a vestibular therapist or their doctor?
So from the patient education perspective, it really comes down to, are these conditions or these impairments, whether it's like you said, dizziness with movement, is it true vertigo? Is it just I'm unsteady on my feet? I think it's important to educate patients, aging or not, that that is not normal, regardless of where you're at in your aging cycle. And a full evaluation of your body biomechanically, your inner ear, your balance, your function, your strength is really important for overall health. And again, as a physical therapist, that's the lens we look at patients through. We don't look at patients through a surgical or a medical lens of pharmaceuticals. So patient education is really big. I can't tell you how many patients come in and say, oh, I trip and I fall, or I've had a couple injuries, but I'm 70, that's normal, right?
Mhm.
Well, not necessarily. It's really important to understand sort of the totality of the patient, whether a neurological exam is involved, a vestibular exam, a strength exam. And again, nobody's better at doing that, I think, and obviously I'm biased here, than a rehabilitation professional. So patients kind of have to understand that there is help, and that falling and imbalance and things that they think come normally with life can be managed non-operatively and non-surgically through a physical therapist. So I think that's the first thing to really touch on. From a clinical perspective, I'll certainly use, myself as an example. I don't think for the first 10 years of my career, maybe give or take, I probably appreciated the vestibular system and how incredibly important it was for equilibrium. So I was doing the best I could to manage patients with fall conditions and injury and equilibrium dysfunction, but not fully understanding the involvement of the vestibular system and how intricate it is in that. Probably, unfortunately, I learned, but we need to know as clinicians that we don't need to just evaluate the musculoskeletal or the strength. That's a very important part of function as well. So I think that's, I guess, from an aerial view, how I would approach that from either educating patients and or clinicians.
Yes, that's really good. Thank you so much for those points of view, especially at home. I'm working at home health team,
Mm-hmm.
and we have many cases of falls, and then they ended
Mm-hmm.
up in hip fractures, any fractures, and then post-op, right? Because of the falls.
Of
But
course.
when you get the history taking, they feel lightheaded, they have this vertigo. Some of them, they really know the word vertigo,
Absolutely.
Yeah. So some of them, oh, I have vertigo. It's been a years now. So I always educate them as the physical therapist. All right, when was the last time you checked with your ear, nose, and throat doctor? So because inner ear is another
Mm-hmm.
vestibular point to check. When was your last time to check your eyeglasses?
Sure.
And also your medication on the pharmaceutical point of view because of the dizziness. So that's
Absolutely.
another way of checking the root if it's vertigo or not, things like that. So education is very important. And I like how you point out that vestibular therapists are really the specialists in this kind of situation. So thank you for pointing that out. And then how important you think, Kim, that being skilled, and then how important nowadays that we really need to focus on investing ourselves in doing the vestibular rehab.
Great question. So again, clearly I'm a little biased, but fall prevention and equilibrium function is just as important as treating the injury due to the fall. And we as a culture, from a medical perspective, historically have been fairly, we're a reactive medical culture. Somebody fell and broke their hip, I'm going to treat the hip, versus the origin of the issue, which may have been the equilibrium system. So I think it's fair that if we're going to be evaluating patients for function and mobility, which clearly we're the best to be doing that, we understand and have a skilled background in how to, in an efficient, evidence-based manner, at a minimum, be able to identify if the vestibular system's involved. We can't be specialists in every single field, and I recognize that. In fact, I always joke when I teach these classes, to some degree, particularly managing dizzy patients, we have to be somewhat generalist sometimes, because there's a myriad of other things that are going on. Like you said, is it a medication issue? Is it a foot and ankle mobility issue? There's other things we have to be able to assess in addition to the vestibular system. But I do think it's very important at a minimum, if we're going to be managing patients with fall risk, particularly the aging population, that we have a handle on a good, at minimum, vestibular screening system. Whereas maybe we're not the best to manage it. Maybe that's not my wheelhouse in my particular clinic, but I need to be able to, at least at a minimum, refer out, know somebody who can step in and give a little bit more skilled intervention to manage that patient.
That's really good. And we have many courses already of vestibular rehab, like a
Mm-hmm.
basic knowledge, that we have. But how, as an American Institute of Balance, the vice president, how do you think American Institute of Balance can help us clinicians to pursue and improve our skills in certifying ourselves for treating clients having the concussion, and I believe you have concussion certification as well,
Yep.
and vestibular rehab itself, and how does it work, and what do you offer?
Great. So we offer a variety of courses around vestibular management, anywhere from the neurodiagnostic component, which as rehabilitation professionals, that's not necessarily our day-to-day. But to be honest, we do get a lot of rehabilitation professionals who want to understand that, because that is the referral engine sending to them ultimately. So we have anywhere from that neurodiagnostic component all the way to what I call our rehabilitation certification courses, which are largely and by far our most popular is our vestibular rehabilitation certification and our vestibular rehabilitation and concussion dual certification.
Yes, yes.
So our goal essentially is to take all of the evidence from international, national sources, as well as our own evidence protocols that are tried and true and published at AIB, and present to physical therapists, occupational therapists, athletic trainers, OTs, people, anybody who's really managing these patients at some point in the spectrum, an evidence-based, down and dirty, practical, functional approach to evaluation as well as management. So our content is divided up, online as well as live hands-on, but our overarching goal is when you come to a certification program or course, you leave ready Monday morning to better equip, I should say, manage that dizzy patient that comes into your office in a more efficient, evidence-based manner. So we definitely pride ourselves on how efficient and just functional our training is and how it can translate into the clinic immediately. So that's largely one of the reasons, we're training, upwards of 1,200 rehabilitation specialists a year now in vestibular and concussion science, which is an awesome, awesome thing to be able to do. So
Yes, yes. That's really amazing. And American Institute of Balance is how many years now helping the clinicians?
40 years. Richard Gans started 40 years ago, and we've been running workshops. I think we're up to training in the last 25 years, upwards of 15,000 professionals. So
Yes.
it is a long-standing institute of research, academia, and patient care, which is why I'm so honored to be part of it.
Yes, congratulations. I remember Dr. Richard Gans also informed us that when you are, the difference of the American Institute of Balance is that every month, every year, it needs to be changed. It should be evidence-based. They cannot teach like 5 years ago, this is what they're doing, because every time there's always a change, an innovation,
Absolutely.
that they always change their courses. So
Yes.
yeah, and I believe, do you have also recertification, and how many years they need to recertify?
Yes. So the original certification is good for 2 years.
Okay.
Every 2 years, we require you to recertify. Now, that does not mean you have to take the entire course again. A lot of people elect to, largely because of the point you just made, Dr. Jenny, about how dynamic the research is, particularly around concussion management. That's probably the most dynamic of the two right now. So every 2 years we do recertify. Our process is we send out, depending on your area of certification, in this case, we'll just use vestibular and concussion as an example. We send out 5 to 10 evidence-based research articles that are specific to the year you recertify, that are the most updated around what your certification is in. And then there's an exam tied to it. So it's certainly not designed to be an easy read or an easy test. It really involves you reading the article, processing it, putting the clinical reasoning behind it, and the critical thinking. And after you've passed the written exam, after reading the articles, we will then recertify you at that point.
Wow. So that's the recertification process, right?
Yes.
So now you offer online, there is a hybrid,
Mhm.
and so let's say it's a little bit challenging for the clinician geographically to travel to Florida. Is it a must really that is there a course that's purely online?
So the answer is yes and yes.
Okay.
So to your point, we have a 40-seat classroom at the Institute, and that has largely been, we'll call it sort of the central area where we teach. In the last 3 years, we do roughly 12 to 14 offsites in addition to our Florida every year. So this year we're in your market a lot. We're in Philadelphia, we're in New Jersey, Dallas, Chicago, we're in Los Angeles, Seattle, we'll be in Kansas City, Cincinnati. So we travel, and I call it the road show. We take this out on the road, so we eliminate the barrier for the travel. The majority of what we're finding, and whether it's COVID related or not, is, people are really needing to stay closer to home. We don't have the time or the resources to travel the way we used to. Busy clinical schedules, family, et cetera. So my goal was to eliminate that barrier. So we essentially are in most major cities once a year, and we're within 3 to 4 hours drive time for most populations, which is great. So that is how we've kind of bridged the gap with the hybrid program, where some of it's online, and then we do require the 1-day live for the certification for the hands-on component. We have a couple products that are purely online that are designed to be follow-up advanced courses to the hands-on foundational course. So the vestibular rehab and vestibular rehab concussion course are sort of we'll call it our foundation courses.
Yes. Mm-hmm.
That are hybridized to be didactic online as well as live component hands-on. Our advanced vestibular course, which you brought up migraine earlier, talks about management of atypical BPPV, migraine, psychogenic dizziness, some of the more advanced populations, is purely online.
Okay.
And then this fall, we'll have an advanced concussion management course as a follow-up to our foundation course that will also be online. So there's kind of a spectrum of courses to take, but we have 3 or 4 that we offer in a hybridized model for hands-on. And then we kind of have, we'll call it the follow-up advanced courses to follow those up with when clinicians are ready to take that next step.
That's amazing. That's really lots of things to you offer a lot of courses, and the clinician has lots of choices. If they want to focus more on concussion, you have it, and then they want to put and take the duo like vestibular rehab plus concussion, hybrid option, pure. So that's really good. And they know what they wanted, what they need because of what the cases in their state. And
Absolutely.
yeah, do you have any help? Let's say financial assistance program, payment later or something like that.
We don't
Pay.
necessarily do any like scholarship or any financial programs per se. We definitely, for our international courses, we definitely follow guidelines on pricing to be more respectful, to remove any financial barriers for people in countries that obviously the financials are much different. We do periodically, and that's why I always tell people, follow us on social media. We do send out quite a few. Again, I hate to use the term coupon codes. It just seems so grocery store like, but we do send out discounts, holiday specials, BOGOs, buy one, get one. So there's always kind of something dynamic and fun tied in and around a holiday. So I always tell people they're time sensitive codes. So pay attention on social media and you'll get them. And that's what the majority of our clinicians do to kind of remove any extra, we'll call it financial barrier.
That's really good. And I'm sure, guys, this is CU related. This will be covered by their CU with CU credits, contact hours. So majority of our job and employers can cover some of this payment, and then that will be covered from your company. And then they have those programs and they can apply for these courses. They just send whatever objective measures and everything, how many, and you can apply it to your company, and they usually support that. That's another way.
Yes, companies are the majority of our clinical partners, hospital-based private practices, have been incredibly supportive of our certification and see the value of having the certification to not only strengthen their clinicians, but strengthen their referrals as well. So
Exactly.
yes, the majority of health systems that we work with offer some sort of financial assistance for that professional development as well, which is always great to hear.
Yes, that's true. I have many colleagues now, and they chose the American Institute of Balance. Especially they have a vestibular rehab. We are
Mhm.
in Delaware right now. When you came here close to us,
Yeah.
we have yes. So that's really, really good. So check. And regarding social media, how can we connect with you, Dr. Kim? So they can check whatever schedules you have, and they will know where state are you doing your road show.
Yes, the roadshow schedule. So obviously dizzy.com is our website and all of our workshops, locations, availability, objectives, all of the things that a lot of people need to know is very, very, very easy to find on dizzy.com, which is a good thing. As far as connecting with AIB, we're on LinkedIn, we're on Instagram. The Dizzy Institute is our handle on Instagram. We're on Facebook. And then I'm also personally on LinkedIn under my full name, Kim Rutherford, PT, Doctorate of Science. So a lot of our colleagues and students and people that we've worked with in the past, I've connected with on LinkedIn. So that's always a welcome avenue as well. So as socially media inclined as I can be, I guess that's the best way to connect with us as an institute, as well as me personally. If you have questions about our courses, you can always email me as well. My email is really easy. It's kim@dizzy.com. So very easy to get a hold of me that way if you have questions about courses or certifications or anything around that.
That's really amazing. You are all over, right? So easy to connect, right? So
Yes,
if they
yes.
have
And
any questions, they can always connect with you,
mhm.
especially what particular courses they are interested to and what are you offering for a specific state. So that's really good. And my last question, I always ask my the people I interviewed. So what keeps you moving, Kim?
What keeps me moving? Honestly, I am so incredibly motivated, even more so than I've been when I was younger, by just my interactions with my colleagues. You know, everybody I work with brings such a dynamic energy to what we do. And I think I'm also incredibly motivated. It almost energizes me to travel and to meet all of the PTs and OTs and rehabilitation specialists, the physicians we train, the audiologists we train. It's really energizing to be out and to, we're put in a position where they're there to learn from us, but I actually learn as much from who we train as they do us. So I really think that collegial networking across all disciplines, honestly, is why I get out of bed so excited every day. It's just probably my favorite part of my job.
That's really good. Especially in LinkedIn, I see when I post the geriatric rehab summit, when they saw Dr. Richard Gans, I saw and met lots of audiologists. I was
Yes.
amazed because I'm more on physical therapist, speech, and occupational,
Mhm.
and then geriatrics. And then later on, I see, wow, we have lots of audiologists there, and they
Mhm.
are a lot. And then I know already because of Dr. Gans, they were able to connect with us because of the
Yes.
vestibular, hashtag vestibular, and then they can see everything about that. So that's really amazing. We have lots of people nowadays. And the good thing with AIB is for everybody, healthcare professionals who wanted to focus in vestibular rehab. So that's really good. So if you have any questions, connect with Kim. And last question, Kim, for our listeners,
Okay.
especially with our clients and caregivers, what's your tip for them to prevent falls? So improve their
Gosh,
balance and fall prevention. What's your favorite exercise when you're still
it's,
practicing?
do you know what's, I get that question a lot. And by no means do I want to take away from our skilled intervention and our specific, we'll call it, impairment driven exercises that we design as clinicians. But I will often, because patients are so intimidated by exercise, at least a large component are, just keep moving and walk.
Oh,
Sometimes it truly is that simple. Drink enough water and walk. And again, I don't want to oversimplify what we do, but movement's improvement. You hear motion is lotion. We have all of these sayings in
yes.
physical therapy, but without overcomplicating what we do or making it a little intimidating to a patient, the reality of it is oftentimes, whether I was doing outpatient or Jenny, I did a little home health as well. Patients were like, okay, what 20 exercises do I need? What do I need to do? And, they were very wrapped up in the complexity of the movement. And the reality was, I just need you to get up and walk and keep moving. And little things like that were so much more functional and just obtainable for patients. That alone does wonders. So that's literally sometimes as simple as it gets with me when I talk to people, is I just give them permission to move again, and obviously a safe manner. And once they get up and start walking, it's amazing kind of what gets going elsewhere. So that's
really
about
good.
as simple as it gets, but that's often where my conversations begin.
That's really wonderful and very simple. And that's what I keep telling them. So every 2 hours, don't stay on the bed, keep changing, get out on your couch, every commercial while you're watching
That's
TV,
great advice.
get up. And doing
Mhm.
commercial, I ask them, when you're watching your favorite series, during your commercial, get up, do your movement and everything, get some water, whatever. So that's really good. So the question is that how can I move if I feel dizzy and lightheaded, So that's the time, guys. You need to check with your doctor, check with your vestibular rehab in your area. So to prevent, dizziness, migraine, they are not normal part of aging. Fall is not a normal part of aging. So connect with your vestibular rehab therapist in your area, and also check with your provider, because more providers now are more aware that there's a specialist that focusing in this. Usually we have a physical therapist and they put on the bottom vestibular rehab therapist. I even discharge my client when I work in acute care. I would like to refer her outpatient with vestibular rehab therapist, because usually physical therapists can be generalized. And in this specific, she fell because of her vertigo. So we want to treat the region as we discussed. So that's really important. So guys, if you have any questions, connect with Kim with dizzy.com, and that will be, and when we posted this, we will going to put all the information where you can connect with Kim, and also we will put her LinkedIn information and also the AID, so you can see the schedules. All right. So closing remarks, Kim, for our listeners, and thank you so much.
Well, thank you for having me. Thank you for the good work you do, Dr. Jenny, and the awareness around fall prevention. That really is a collective effort that we all have a responsibility for, regardless where we're at, whether we're in academia, research, home health, outpatient. So I'm just honored to be part of it. I look forward to seeing you more. I look forward to hearing more from more colleagues out there. I want to get as many people educated in vestibular and concussion management as possible, and just we're your resource. So let's all work together and move forward.
And wonderful message. So guys, if you have any questions, I can directly connect you with Kim, and connect with us with Physiogen PT and Wellness, and also the Balance and Fall Support Group. So we are here for you if you have any resources that you might need, especially in your subject, or things that you are asking some questions, or there's a skill that you want to improve. So connect with us, okay? So it's me again, Dr. Jenny Yusuf, your physical therapist. We have Dr. Kim Rutherford from American Institute of Balance, the Vice President. And we have a wonderful night tonight. If you are going to connect with us, we are available in Facebook and also in LinkedIn. All right, guys. God bless and take care for now.
Thanks,
all right,
everyone.
Bye, guys. Thank you so much, Dr. Kim. Have a great day.